The latest medical research in joint pain is showing us that chronic inflammation, the process that causes pain and degeneration, traces back to a process called angiogenesis. Now, angiogenesis is where the body creates new blood vessels to promote a healing response after an injury to a muscle or a joint. Now, inflammatory conditions such as arthritis, blood vessels expand into the joint and flood the area with inflammatory hormones and cells that eat away at the cartilage like little Pac-Men. Now, as the joint breaks down over time, it loses a protective fluid layer, and the two surfaces begin to rub together. Now, as cartilage layers continue to wear down, ligaments and muscles tighten up to provide stability, and the joint begins to feel that stiffness, all right, that chronic feeling of needing to stretch. Treatment options such as steroid injections and medications provide short-term relief from inflammation, but pain usually returns after a couple of months. So that leaves us with our other option, joint replacement surgery. Now, surgery is invasive and it has a long recovery time, and it isn't guaranteed to relieve your pain. Now, we understand your frustration. These are not great options. Now, our integrative offices combine a non-surgical procedure called embolization that targets the inflammatory blood vessels with advanced physical therapy techniques to restore function and eliminate the cause of pain and degeneration. Now, as you can see in these before and after MRI images, inflammation is significantly reduced in these patients, and these guys saw dramatic improvements in their pain and activity levels in just under a month. Our protocols are safe and effective for everyone, including those with diabetes, osteoporosis, and obesity. Even if you have these conditions and aren't a candidate for surgery, you can get relief in our office. Now, if you're the type of person who wants long-term solutions that don't involve surgery, then we are the perfect place for you and your loved ones.